The American Medical Association is clarifying how body mass index, or BMI, is used as a measure of medicine and your health. 13 on Your Side health reporter Elena Holland spoke with a local doctor about the measurement. And Elena, what does he say about BMI?
Well, Juliet, he says it has limitations. It's a tool, but not a perfect indicator of health or indication of disease.
Screening tool, but not the be-all and end-all.
Dr. Matthew Boutel is a family physician at University of Michigan Health West. He explains body mass index, or BMI, is a calculation of height to weight. It's used to help classify people for weight disorders and determine their risk for health disease.
I think that it has its limitations. We certainly are learning a lot now that it can both underestimate some patients and overestimate other patients.
Those limitations include not accounting for muscle mass, cultural differences, and people who have health conditions not related to weight.
It was actually designed by a person who was trying to determine the average size of a man. I believe it was somebody who was involved with the military in Europe. It was certainly a male generated kind of measurement.
The American Medical Association this month called BMI an imperfect way to measure body fat in multiple groups. That's because it does not factor in differences in race, ethnic groups, sexes, and age span.
Some cultures have a tendency towards having more health problems at lower BMIs, and other groups that may have less problems until they get more significantly elevated in their BMI level.
The AMA suggests BMI to be used along with other measurements, things like body composition, measuring visceral fat, and body adiposity index. Dr. Boutel likes to use waist circumference measurement to indicate tendencies toward possible health problems.
What I'm stressing when I see patients in my office now is to say that it's not just that you need to eat less and exercise more, but we need to figure out, is there genetic factors? Are there, lifestyle, are there things that are in your body that are making it more difficult for you to make those changes, rather than just identifying patients as obese or not obese, or giving them a number and saying, okay, let's put you in that little box kind of thing.
Dr. Boutel did say moving away from using BMI as a main indicator of health is a work in progress, as many doctors are still using it. In the newsroom, Elena Holland, 13 on Your Side.